Hi, I'm Dr. Carrie Best, Peer Assessor at the College of Physicians and Surgeons of Ontario. Ontario MD is collaborating with the college to provide CPSO assessors with training videos on how to review the electronic medical record. This video will demonstrate how a CPSO assessor can review relevant practice information using Accuro by QHR. In viewing this video, the assessor will become familiar with key components of the record that they are assessing. This is a demonstration of Accuro EMR software by QHR created for the purpose of producing an instructional video for CPSO assessors. This demo is being recorded on a PC. An iMac screen might look slightly different. There is an assumption that the assessor will be accessing a computer with Accuro open on the desktop set to the login screen. The previous user's login name might be listed. In this demonstration, the login area is blank. The assessor will enter their own username and password provided by the clinic that they are assessing. In this case, the username is guest. I will use the password provided to me by the clinic in the space below. When the password is entered and the login button activated, the assessor is brought to the home screen. On the left-hand side of the screen, there are icons present that the assessor can use to navigate through the record. Below home is the scheduler. If selected, this icon will open up the schedule. If the charts to be assessed are listed on a daysheet for that particular day, they might be found in this section. From here, one can also do a patient search by name in the top right-hand corner of the screen. This can also be done from within the EMR, so this section will likely not be used by the assessor. Below Scheduler is the Patient's icon. If selected, this icon will open up information about a particular patient. Initially, the demographics appear. Below Patients is the Documents icon, which will likely be blank as an assessor does not have any documents attached to their username. Below Documents is the Claims icon, which looks at billings. It is unlikely that an assessor would be evaluating this area. Below Claims is the EMR icon. If selected, this opens up the patient's record, starting with the provider's daysheet for that particular day. As an assessor, the daysheet will be blank unless the clinic placed the names of the patient charts to be assessed on the daysheet for them ahead of time. From this area, one can tab over to look at the encounter notes, chronic conditions, virtual chart, medications, patient information, and antenatal sheets. There is also a screen lock, which is used while physicians work to secure information between exam rooms, and logout, which can be used to log out of Accuro. When performing an assessment, a physician might prepare a list of patients for the assessor on a daysheet. This will be found by clicking the EMR icon and the daysheet will appear. There is no need to search for patients. One just double-clicks the patient name on the daysheet to access their chart. Whenever a patient is chosen, the patient name appears at the top of the record so that you can always be sure which patient chart you are working in. If the physician provides a daysheet under their own name or an assessor wishes to go back to review patients from previous daysheets, these can be located by highlighting the provider's name from the drop-down section at the top of the daysheet. In this case, we will choose Dr. B. Accuro. Once chosen, one can choose a different date from the drop-down Date menu, and a different daysheet for Dr. Accuro will appear. Highlight the patient name on the daysheet that you wish to view and double-click. The patient's name will show up at the top of the chart. In this case, we are using Brianne Test. Suppose the physician does not provide a daysheet, but just a list of patient names outside of the EMR. In this case, you can find individual patients in two ways. One way to find a patient is through the EMR, Encounter Note screen, by entering the patient name in the search box located at the top left-hand corner of the screen. Another is by pressing F1 and a search box pops up. Now that we have chosen a patient, we can move through the patient record. Choose the patient's icon on the left side of the screen to reveal the patient demographics. The assessor will spend the majority of their time in the EMR section. Let's select this now. When first selected, the day sheet will appear. Click on the Encounter Notes tab. This essentially opens up the patient chart. On the very top, the patient name and age will be listed. On the left is a listing of recent past appointments. In the center of the screen, one will find the encounter notes, the most recent being at the top. Only a summary of part of the note is present, with the name of the provider at the top of each encounter, along with the date the note was entered. One can double-click on any note to open it up in a new window to read it in its entirety. Scroll down on the side to see all the notes in the chart. At the top of the record is a drop-down menu called Filter that can search the encounter notes for certain providers. For example, one can choose notes from only the physician you are assessing from the drop-down menu. In this case, it is Dr. Accuro. Or by date, most recent, last few months, and so forth. If this section seems a bit crowded, one can go to the patient summary icon at the bottom of the chart, then Encounter Summary to see the same information, but in a larger, perhaps easier to follow format. From here, one can see the entire note by clicking the blue writing at the bottom of each section. This is assessor preference as to how they prefer to view the chart. Back to the EMR section, Encounter Notes tab. The CPP is found on the right of the screen, starting with a list of history of problems, including the dates the problems were diagnosed, a list of active medications, including the date prescribed, external medications, which are over the counter, allergies, immunization schedule, and summary, lifestyle, including risk factors, CDS summary entries for a listing of chronic diseases, endoscopy, family history, remote medical history, past prescription trials, preventive care, and social history. One must scroll down to see the entire CPP. In the medication section, one can hover the mouse over a medication to get further information regarding the date the prescription was written and by which provider, modified and initially started. An alternative way to view the CPP